Now, 1 foot off center.
And now it's on, gonna blow your mind.
And Rick Maddison here, 1 foot off center. We have big show today, big show. I want to introduce my panel here. We got Scott Lanigan, head pastor at Trinity Church. Welcome, Scott.
Lead.
Thanks, Ron. Thanks
Lead?
for catching that.
Lead. Good job, Ron.
Is it lead pastor?
Yeah. Lead.
Oh.
Lead.
Rick doesn't see me. It's just no.
You have to go to church to learn.
Yeah. Wow.
Jeff Cox, CEO of Simply Benefits and partner at Asira Insurance. We got Ron Mattiussi, former CEO of Kelowna, still heavily involved in fixing this province with municipalities.
One corner, one piece at a time.
One piece at a time. Okay, we're going to talk about soil to sod landscaping. Landscaping comes down to good ideas. I had several bad ones when I was building my yard, turns out. Pat very gently said, no, we're not doing really any of those ideas. He was talking about best use of xeriscaping, and several years later, patio blocks still level. Scott, when you install your patio blocks, I mean, we're talking the topography on that thing.
Yeah, people walk backwards and backwards while they walked into my backyard, and they're like, did you build a retaining wall, or is that a patio?
It's so all over, and I don't like it.
No.
Okay, I don't like what you've done. So if you choose to do it yourself, good on you, but not very good for soil to sod. So hire soil to sod landscaping; they'll take care of things. Don't sell sod, by the way. Okay, so I want to talk about something that's...
This is not serious. Start laughing.
Like a transition.
If I was Pat, I'd be like, wow, I'm so glad Rick is he's our front man.
That $50 is going a long way.
45.
Our
You know, there's
sales
taxes.
went down
There's
over the
tariffs
last
on
2
the
months.
45. So I want to talk about a few different things. They're kind of lumped in together, but David Eby doesn't go to the Premier's conference with the new Prime Minister. We have Chinese ferries. We have Airbnb restrictions. Healthcare's a mess. What is our report card for the NDP? I'm sure there's some good stuff in there, but I mean, he didn't go to the Premier's conference, and I know we do talk about local issues here, but is there a ripple effect? Because I do think the Premiers were going with a wish list of things that they wanted for infrastructure for different regions, and I just don't know if the assistant who showed up at the conference was able to get as much as, say, I don't know, the Premier. So, Mr. Ron, you want to lead us off, or actually, Jeff? Let's go, Jeff.
Let's go with Jeff. Oh, great. I mean, it was a miss for me. He had a trip plan to Southeast Asia. Cancel it. You had every premier in Canada in a room with a new prime minister to talk about how we're going to move this country forward, and you didn't show? What? It doesn't make sense. I don't get it. And then to come out, listen, agree with this or not, I right now, to me, Danielle Smith is the canary in the coal mine on what's going on in Ottawa. You don't have to like her. You don't have to agree with her. You don't have to never vote Conservative. She will tell you, though, if it is going right or wrong. I believe that. And so when she is coming out of those meetings going, cautiously optimistic, Doug Ford is saying, best meeting we've had in 10 years. I think it's the only meeting we had in 10 years with Ottawa. But anyway, that aside, okay. Still a good one. It is going to be a long haul on that decade. And you don't show. And I go, what? And then to start throwing roadblocks about we're talking about pipelines, not through my province. Whoa, you didn't show up for the meeting. Like, I just feel he's very disconnected to what's going on. Then you couple with the challenges that things you didn't list, like people are fleeing here in the masses. We're struggling with it right now in our own workforce. Like that time of year, people are kind of raising their head and going, I'm out of here. What? For what? Can't afford to live. Better over here. So there's just, to me, not showing was whatever was planned. You push it, change it. You got to be in the room.
Mm-hmm. What do you think, Ron?
I think you got to be in the room. I think this is a pretty critical time. He wasn't there, so they voted to have a pipeline through BC. So obviously, don't show up to meeting and volunteer. Let's put the pipeline through BC. He's not here. No. I think maybe it's just me. Call me crazy, but I this is a pretty significant moment
in our national history. We talked about this pre-election, which is, to me, a very significant one. I do think you now have a prime minister who, like him or not, he's going to make political mistakes, but I don't think he's going to make policy mistakes. I think he understands this is a time where we do have to work together. We do have to figure all this out. He understands business. He understands. So, kind of passing up on a, I think a pretty critical meeting. And I don't know why, but.
Well, what was interesting is I heard a story that you had a meeting with different people from the development community, and just in order to figure out some policies and surrounding building, and you're a planner, and you invited what is ostensibly the opposite part of the table and said, let's figure some stuff out. We may not agree on everything, but at the very least you let them have an audience, and I think that is the part that I think we're missing, is let's figure this out. We may not come, but there's some common ground thing, and I think that was the part that most disappointed me, was you don't even know if you have common ground. Like you weren't even there. So, but I appreciated that about when you were in office, you decided, I'm going to go talk to the people that, I should give them some time.
Yeah, I mean, the development community is a bit like that. I mean, the development community is an important part, like it or not. Some people who, think this is horrible, but no, it's part of our economy. I mean, Kelowna's business is development in many ways, right? I mean, that is what's produced here. And so not to have the industry, I mean, how could you, I think it's always dangerous when you make policy and you haven't actually sat in a room with the people that are impacted. You might not follow their advice. There may be some reason why you can't do what they want. Danielle Smith, there's going to be some reason why you can't do what she wants. But you have to listen, right? You have to talk, and you have to at least come to the understanding that you were heard. To me, that was the most important thing. When people left the room, to me, it was nobody said they weren't heard.
Yeah.
Right?
Mm-hmm. To me, it's the, like you have a seat at the table and you don't take it.
Yeah.
Like that to me is like, it's obnoxious that you don't even, you underestimate. I think it's like, read the room. You underestimate not only the national feeling right now of, hey, we need to be more united. Yes, we have opinions and thoughts of the last 10 years, and we need to just put those aside for a moment. We can still hold them, but let's maybe just take this one opportunity to lean in a little bit and just listen. And everybody knows it's the meeting after the meeting. And you didn't show up maybe for the main meeting. You didn't want to be at the main meeting, but all those individuals and those premiers they're hanging out afterwards. They're going to be talking. They're going to have a conversation. Who knows what conversations you missed out on, that now when he tries to come to the table, everyone's going to be like, well, you skipped the big one. You weren't there, right? And you chose not to. And now that's I wonder if that's even recoverable at some point, because now you're the guy that opted out when everybody else opted in. And I, if I was a premier of another province, I'd be a little pissed off about that. I'd be like, like I didn't want to be, like Danielle Smith, she probably didn't want to be there, but she's like, hey, I'm going to show up because I feel it's better, like you said, to be the canary in the coal mine rather than be the one that doesn't get to put your voice and your thought forward. And to me, it's a big miss.
You also can't speak out of both sides of your mouth. I mean, David Eby has tried to make Donald Trump his COVID. He is marching to it harder than anybody. Don't get me wrong. I mean, Doug Ford stepped out but has retracted and said, and David hasn't. It is like, no, I'm going to take this guy to task. Ironically, his own interprovincial tariffs far exceed any that Donald Trump has ever put in place, and he's not willing to back down from them. And he's not willing to back down from them because, well, you want to come here and build? Well, are you union? No, okay, you're out. You want to come? Like, I mean, that's the piece that I go, you what? Like, and again, an adult in Ottawa said, all right, I want everybody in a room, and we're going to hash this stuff out. And I'm not bringing Chrystia Freeland, Anita Dodd, and Stephen Gobert. I'm actually going to listen and know what my lieutenant of Quebec said about pipelines is not true. But he did, and that's where I give him credit. Like he has put people in their place. I mean, I can't believe I'm getting the credit I'm giving, but I got into this.
I can't either, but
I know, because but I got in the scrap, and this is the part we've talked about this, where you got to come together.
Yeah.
If Pierre Poilievre had come out and said, we are going to spend 2% on defense next year, every conservative in Canada would have been raging that it was the right thing to do. And I'm like, he did it. And I'm like, great. And this guy's spending money yeah, I don't get me wrong. There's a budget that needs to happen, all these things. But if Pierre said that, every conservative would be absolutely ecstatic. And so I'm like, that's a good move. Yeah, I'd like to see a budget. And I wish Frankie Bubbles wasn't in charge of that budget, but the reality is, I like, you have to give him credit. And again, this is where I go back to our province. I'm going, man, you're like the train, to your point, I think the train's left the station, and I'm not sure you're going to catch up to it. And that'll be their challenge.
The only problem is, and this is just anecdotal conversations across the city, but people are saying, yeah, we voted for EB because we just couldn't get the warm and fuzzies from Rustad. And again, I lean more towards conservative side of things, but I'm like, I know, it's weird. But part of me was like, I think we didn't have that person in place. Maybe, not maybe, but he didn't win. So there's the proof in the pudding why EB's in and Rustad is out. So I don't know, but again, you see these Chinese ferries incident and the no pipeline thing, and I'm like, it's early days, but I don't know. I'm starting to wonder if they're kind of losing the voter base.
Well, they may, but again, where are they going to go? So one of the interesting things that Carney put on the table is that I think most people recognize that he was more of a Paul Martin liberal, pretty conservative liberal, and people were comfortable with that, right? And I think people that did vote said, okay. I mean, I had people tell me that they'd never voted liberal in their life, voted, right? Because they saw that he had that. And I think you look at now provincially, where's that middle ground, right? Like, I mean, to me, Rustad's off on a tangent. And I think when the SoCreds, people forget the SoCreds were a coalition of federal liberals and conservatives whose sole purpose was not to have the NDP win. and I think, you look at subsequent, Christy Clark was a liberal. Yeah, she was a liberal. I mean, not everybody's cup of tea, but was able to win that middle of the road. And I think, one of the lessons here is you go too much to one side or the other, you now have a problem in BC. Right?
And that is where we're at. The right has got the center right, which is probably more like center left in this province, has to figure itself out.
Yeah.
And I think John Rustad honestly gets misrepresented. I think if you dig in on John, I think he means very well. I think he's super respected in northern British Columbia, where people know him. He's respected in the Indigenous community. I think he gets painted with a brush, and he has had, and it's biting him now, this idea that no, we'll let everybody say their piece. Well, now your caucus is divided. I do think the party would be, I mean, it's easy maybe sitting this ride and to say, like, Gavin Durand for the Liberals didn't win. Could he be a better leader here? For me, Eleanor Sturko would be a phenomenal person to lead that. Again, caught up in the name, to your point. I mean, maybe they do have. Maybe somebody needs to pull out the SoCred banner and wave it back up, right? But it's got to happen. It's got to happen soon, because what is going on in this province, what is happening here with our healthcare here locally is I mean, it's almost bizarre.
Well, yeah, and that's the other subject I was going to talk about is I keep seeing the headlines of ER closures across the province, and one of our shows, I had one of the contractors for traveling nurses very quietly say, "Can I have a coffee with you?" Well, I'm one of the 7 that's vetted by the province. Our province has decided to pay a certain amount and cap it. She goes, the problem is we have a province right next to us that pays more. So as a traveling nurse who has to leave the home, be away from their bed, has to, like, it costs more to live outside of your home. So she said, as a result of that, they're paying $95 to $100. We're nowhere near that, and so as a result of that, unless you love the mountains and the beaches and the water, you're going to Edmonton. You're going to Red Deer, and that
Your
is
housing
going
costs a lot less.
and your housing costs less. So, you know, she said there's a train coming and it's already here, and she says I don't know how you can pull it back because they've said we're capping this spending. We're not going any further, and and we have some issues with Interior Health because the pediatric wing has been shut down for, like, I've never heard of that before.
No, I actually had, we have a couple postings for positions, and one of the candidates that was kind of high on our list, they had some their daughter, 2 years old, pediatric issues, lots of doctor visits, and they're like, hey, how's your peds in Kelowna? And literally it's the same week that I'm like, well, for the first time in history, I'd like to say it's great, but we just shut down, right? And I couldn't believe I was like saying that out loud. It was to me such a shocker that was a reality.
We all have children, so we all know we will do anything for our families. We'll do anything.
You fathered children.
I have. And they're actually turned out,
there's some things that are
they turned out okay. It was weird, but the other thing is, a close friend of mine, his daughter went through some stuff, and I'm not going to go into the details, but he said, like, we need that. Like, there's no like, well, maybe, he says, we needed that service, we needed that help, and it was closed. And I can't even imagine the anguish as a parent when that happens. So I just feel like we're going down, again, I hate to say this, but the healthcare just seems to be in BC, maybe not in Alberta. Alberta has its own issues.
Yeah, no,
but like,
not any better.
I mean, is IH?
Well, yeah.
Come on, this is where we get into the fun stuff.
I don't know. Not my business. Now it's I think one of the things we're fighting was back in 1994, 95, meeting with the provincial government in Alberta. I was in Alberta then. I was director of the Edmonton Metro Regional Planning Commission, and they were getting rid of them. And the deputy minister, we were talking about, okay, how do we shut these things down, in a rational way? And he was quite blunt, and he said, the biggest crisis we have is to prepare for the pig and the python, and that's when you guys at the bottom end of the baby boom, I'm 69, so I'm at the bottom end of the baby boom, get old. Because the same thing we built all the schools for, and we built all the universities for, are now at some point going to take up hospital beds.
Yep.
And once you're done, we're okay again. And so we're kind of in that crisis. Like, I'm 69, I'm in the bottom of the baby boom. So we're probably never had as much pressure on that system. And again, I'm not judging, are they failing anyways, or could they? But it's also at a critical time demographically,
right,
to try to deal with this problem. They knew that in '95 that this crunch was coming, and they were already, that's where Ralph Klein was kind of chopping stuff out, because they said, well, the province is going to have, one big thing that they're going to have to deal with eventually. Everything else will take second stage to the aging demographic.
Is Jeff, do you think, like, obviously, do you think our own regional, I'm talking about IH, has the ability to innovate, to pivot, or is it just the pig and the python?
I just think you get to a stage where there has to be change. So, and I mean, the story that's been ran since the pediatric closure, but post leading up to it, was about its CEO, but Susan Brown. So Gavin Dew takes a significant amount of calls at that time, the MLA in that area, and says, okay, I'm going to start looking into this. Does his own dig and identifies that, maybe it's leadership that's the challenge. Castanet ran an article today that the 5 municipalities in Interior Health, their mayors penned a letter in 2022 to then Minister Adrian Dix to say we need change in leadership. I don't know how many times you have people in these roles come out and say that we need to change your leadership. Listen, is it better in Calgary? No, you're not. Emerge in Calgary is not significantly better than it is in Kelowna. I've not experienced it, but if it was, that story would be running left, right, and center. And I know right across the country we have healthcare challenges. Now, could it be? Does it appear that we have some serious challenges in interior health that need some change? That's becoming quite apparent. But I think that again, how did 5 mayors of the largest cities in interior health go to Adrian Jix in 2022 and A, that story not get out, and B, him not make a change, which again falls. I mean that if there was anything of when the NDP won, I mean, if I breathe any sigh of relief in British Columbia, it was that Adrian Dix was not in the healthcare portfolio anymore. So now the health minister has stepped out and said she is behind the current leader of Interior Health. So it is what it is. There's quite obviously though some inner workings here that need to be untangled. So
I wonder about the size of Interior Health.
Yeah, it's a great question.
When they actually drew that massive boundary, and I think somebody looked at it and said, "Wow, we can consolidate all these costs, and we could reduce the administration." And I think it's like anything else. Something gets lost. Right?
And if people don't understand, you're talking about 100 miles of the border,
Yeah.
and then east of Cranbrook. Like that is interior health and everything that falls in that realm, right? Like it is, and west to Merritt, right? So
centralization.
Is it Merritt?
I
No,
think
it's
so.
actually
Hope.
Hope.
Is it Hope?
I remember during
Hope fell
COVID.
into,
During COVID, you could drive to Hope, but you couldn't go to Chilliwack.
Right.
It was crazy, but they're part of it.
I mean, it is a massive demographic. So.
What do you, are we writing letters, Scott? Like, what do you think?
Am I going to write a letter?
Can you write a letter?
I can pen a letter. I'm pretty good at it. I was going to say, referring back to the individual we talked, that was the nurse, I believe, and I think we used to be able to sell like the sunshine tax, and everybody, and I think it's just lost its shine, and I don't think people care anymore. And the sparkle. And I think people are trying to find places where they feel like they can get better healthcare, they can get better services. But you're like this. You're right in saying that Edmonton or Calgary isn't necessarily better, but it feels better than what we're dealing with here. When there's just continual gaps, and I think what I feel now is what's next. What's going to be the part that I'm not going to be able to depend on next, and I think that's especially frightening.
Well, on the sunshine tax right now, because you can do this math, that aside, how quickly you can get a doctor and all those things, is running between 30 and 40%. So you can move to Calgary and live in the southeast of Calgary in Cranston, and you're going to keep about 30 cents more on every dollar than if you live here. That's just factual. Like that math has been done. You can
30%?
Yes. Yeah, it's a little bit higher than that actually. So you talk about pressures, again, especially when you're that middle income bracket. I mean, how much are you willing to pay for the sunshine?
Yeah. Now, having said all that, having been unfortunate enough to end up in emergency a few times over the last few years, my partner was amazed at how well the emergency functioned at KGH and was shocked. Not only the level of care, but actually it was care. The professionals that worked on you, and every step of the way they were polite and they were caring, and they were caring to the people in the room. You sort of observe, and so I don't think the problem is necessarily on the ground floor, right?
No.
Those people that go to work every day. I had never had a bad experience.
I would agree,
emergency.
and I know enough of them that I sit amazed at what they do in a shift. But I think along that same time, the story came around the peds closing. As our own pediatrician, she made she did the reel, and she said it's a decision now, and I've got this child that came into an emergency, and then I get a call to go to another emergency situation. Well, who wins? And when there's one of us. What do you do? And I can't imagine dealing with that every single day. And because you're just, you're not going to be right no matter the circumstance you do. You do the best that you can, and you have to make a decision. And I feel for our frontline workers caught in that every single day.
I don't think I'm with you. No, I wouldn't. And I have family that we've has had some struggles with healthcare, and I will say when it's urgent and emergent and serious, it gets delivered on. It would be very hard to. I mean, again, everyone has their challenges, but this is not frontline workers.
No,
it's in fact we have 3 administrators to every one frontline worker in Interior Health.
Yeah.
Like nobody does that math and says, yeah, that's right. Like no one. In fact, if it was reversed, you'd say, well, that number's a reasonable ratio, right? Could we get it to
4 or 5?
Yeah,
Mm-hmm.
but to actually think that it's the other way around right now, I mean, that's crazy.
And I wonder if some of the problems we've talked about, and again, not knowing, and so forgive me those that are in the administration of health, but you do see that, and is it the function of the size of the organization that the left hand really doesn't know what the right hand? And I saw that countless times. You're dealing with a question of homelessness, and this person has is mentally ill, is drug addicted, multiple health issues. And and at various times they come up with ways to deal with that, but at other times it almost seems like they don't see the organization can adjust. Individuals within it try and may reach out, but you just wonder if the size of the organization is such that it's just too big.
Yep.
I almost think, though, that we're, as a province, it almost feels like we're resting on our laurels a bit. That, well, we're beautiful, we have mountains, we have streams, and we're more expensive, and houses cost way more, and our food is more expensive. Like, it feels a bit like they'll still come, but we're starting to see that reverse migration that we saw earlier, where people from Alberta and Ontario especially were coming here in droves, and now it just feels like a reverse is true, where people are like, I want to enjoy more of life, and I don't want to just work for my house. I think house poor is a real thing.
We could become Costa Rica, where there's always rich people who can afford to live here, and then on the other end of the strata, where you have where you're going to get service level jobs. I mean, I worry about that discrepancy that the average guy he's much more easily move to Calgary and whatever he's going to do, frame houses or whatever. He's not going to do it here, right?
It's funny though, my kids. I say to Jack, so Calgary's land of opportunity. I can never live in Alberta, Dad. Come on. Come on. Like,
Yeah,
okay.
well, he's got a point there.
Yeah, he
Look at
does.
us. Why are we here? All of us, right? Pretty much.
Yes.
All of us.
Us,
Collectively.
present company excluded. Thank you again for watching, listening. We are 1 foot off center, and stay tuned for the next episode. Thank you, Scott. Thank you, Jeff. Thank you, Ron. And we'll see you next time.